Okay, guys, so today we're going to learn all about cataracts. So by the end of this lesson, we will understand what cataracts are, how they are formed and treated, and the different nursing considerations when we are caring for these patients. Okay, guys, so before going a little bit deeper, I just wanted to review the lens and its function just so we have a really good foundation to build upon. So when we're looking at this picture right here, you can see the lens. That's right here. So the lens in a normal eye, it should be transparent and flexible. It's super important because it helps bend the light rays and helps them focus correctly on the retina. Okay. Okay, guys, so now that we have those basics down, let's go ahead and move on to cataracts. So a cataract is a clouding of the lens in the eye, which, remember, the lens should be clear and transparent, and this leads to a decrease in vision. And if left untreated, it can lead to blindness. So you can see in this picture, the lens, it's not clear, it's cloudy, and it has this kind of white opacity to it. So this is a cataract. Basically, a cataract is a lens, it's lost its transparency, it's lost water, and it increases in density. This then changes and distorts the image that's projected onto the retina. So kind of looking at the causes of cataracts, they can be present at birth. They can also be age-related as well. So cataracts are kind of expected in all people that are older than 70 years of age, just because the lens just gradually loses water and increases in density with age. So as we age, fibers can become compacted on the lens, and that's kind of what happens with aging, which is why we see that in our older population. So kind of like I said, the density occurs as the older lens fibers are compressed and new fibers are produced. So we kind of have this kind of building effect, which leads to that kind of not transparency that we see, so that opacity that we see. As the new fibers are produced on the outer layers, the lens proteins dry out and they can form crystals. So cataracts can also be due to different environmental factors. So this could be due to trauma to the eye, such as with like a sports injury. So a person gets hit in the eye by a baseball, that can lead to a traumatic cataract. It could also be due to chemicals or toxic agents, just such as like radiation exposure. They can also be secondary to other disease, such as diabetes. And then diagnosis is based on visual acuity testing. So we use the Snellen chart for that, and by performing an eye exam. So the eye exam will show the clouding of the lens. Okay, let's go ahead and look at assessment findings and compare and contrast the early versus late assessment findings. So initially, patients can report slightly blurred vision and decreased color perception. So really in the early stages, patients may not even notice that something's wrong. They could just think that their glasses are smudged. And these changes can be so slight that they just go unnoticed. So vision just continues to get worse until it gets so bad that things that like driving become unmanageable, and really they just continue to compact and just get worse. And this leads to blurred vision, double vision, difficulty with ADLs, and it can lead to blindness if untreated. So kind of like I said, since the loss of vision is so gradual, the patient might not realize their vision is changing so drastically until driving or reading is affected. And then when we're looking at the pupil, it will appear white due to the opacity of the cataract. So just to kind of review the early findings, patient's just going to have some slightly blurred vision. They could also have some decreased color perception as well. And this is overall vision changes. And both of these, it's the whole vision field. It's not just a certain part of the, of the vision field. It's their entire picture that they see. Okay, so as far as treatment goes, surgery is the only cure for cataracts. The procedure that we normally see performed for cataract removal is called phacoemulsification. So let's go ahead and look at this picture over here. This is kind of showing that procedure in finer detail. So what happens is they make a slit in the eye so they can access the lens. Once the lens is accessed, they place a little probe in here so sound waves can help break up the lens, and then they can be removed by suction. So we're breaking up the lens. Okay. And then they are removed by suction. And then once all of the bad lens is out, it's time to go ahead and put a new lens in. So this is when they go ahead and put in the new intraocular lens right here, and it folds down, and yay, the person can see again. Okay. So guys, if you have time, I highly recommend checking out the link that I attached to this lesson. It's just a 5-minute video on phacoemulsification. I think it's such a cool procedure. You should definitely check it out if you have time. Okay, so nursing considerations. So after surgery, patients will have to administer different kinds of eye drops several times a day for 2 to 4 weeks. That's a lot of eye drops. So we need to make sure that patients kind of understand, they're going to be doing lots of eye drops. Mild itching and slight swelling are common side effects to occur post-surgery. So if patients are, if they are saying, hey, I got some itching, you can reassure them that that is a common side effect not to worry about. Pain is usually controlled with acetaminophen or acetaminophen with oxycodone. And then it is really important to prevent increases in intraocular pressure post-surgery, as this could lead to different complications. Increase in intraocular pressure. Okay, so some of the different things that we want to monitor for include significant swelling, bruising, infection, severe pain. So pain is expected, but severe pain is not expected. Bleeding, increased discharge, or yellow discharge, decreased vision, or floating shapes. Those are all abnormal findings, and they need to be reported to the provider right away. Okay, so part of patient education is going to center around prevention of cataracts in the first place. So, like we kind of said, cataracts can be due to trauma. So if a patient is in sports, if they are batting, having them wear a helmet with a face mask, that's a super easy way to help prevent a trauma-related cataract. And then another thing that we can do is having patients wear sunglasses when they're outside to protect the eyes against harmful UV rays. Post-surgery education, it's around activity restrictions, so different things to prevent increases in intraocular pressure. Eye drop administration, so they're going to have a lot of different eye drops to administer for a couple weeks, and then different complications to watch for. So increased redness and yellow or green drainage from the eye could indicate infection. Okay, so the priority nursing concepts with a patient with cataracts includes changes in functional ability and sensory perception because the patient has alterations in vision. So this directly affects activities of daily living and their ability to see. And it impacts their sensory perception because they can't see well, so their senses are going to be off. All right, guys, so let's go ahead and go over the key points. So cataracts are due to a clouding of the lens in the eye, which impacts vision and can cause blindness if untreated. So one of the key points that I want you to remember is regarding prevention. So patients can wear sunglasses and protective eyewear to help prevent that eye to try to